Is your bathroom a secret stroke risk? 4 common habits could be tripling your danger. Discover them now before it's too late. Are you safe? Nighttime excursions to the bathroom are a common reality for many older individuals in our communities. While often viewed as a mere inconvenience, these nocturnal trips can harbor understated yet serious health implications. Specifically, the circumstances surrounding these visits can elevate the risk of cerebrovascular events, commonly known as strokes. A thorough understanding of these contributing factors is vital for safeguarding health and preventing critical incidents. This information aims to provide clarity on why these moments warrant increased caution and awareness. Frequent nighttime urination, termed nocturia by medical professionals, is notably prevalent among older adults. Age-related physiological shifts, such as diminished bladder capacity, play a significant role in this pattern. Hormonal changes, including alterations in antidiuretic hormone production, also contribute to increased nighttime urine output. For men, an enlarged prostate or benign prostatic hyperplasia often leads to more frequent bathroom needs. Certain chronic health conditions, like diabetes or congestive heart failure, can further intensify nocturia symptoms. These underlying reasons mean nighttime awakenings are not just habit, but often a physiological necessity. The compelling urgency to urinate can understandably prompt individuals to rise and move with haste. Such rapid transitions from a supine or lying down position to an upright stance are physiologically demanding. The body's autonomic nervous system, responsible for blood pressure regulation, may struggle to adapt swiftly. This can result in a significant, albeit temporary, decline in blood pressure upon standing. This phenomenon, known as orthostatic or postural hypotension, is exacerbated by hurried movements. Rushing, therefore, intensifies the risk of dizziness, lightheadedness, falls, and insufficient cerebral perfusion. Dehydration represents a common yet frequently overlooked concern. Within the older adult population, the natural thirst mechanism can become less acute with advancing age, leading to insufficient fluid consumption. Furthermore, some commonly prescribed medications, especially diuretics, actively promote fluid excretion from the body. Even a seemingly mild state of dehydration can lead to a reduction in overall blood volume. This reduction in blood volume renders the circulatory system considerably more susceptible to sudden pressure drops. Dehydration also increases blood viscosity, or thickness, potentially heightening the risk of blood clot formation. Consequently, a dehydrated state impairs the body's capacity to manage abrupt postural adjustments effectively. Many older adults manage chronic conditions with medications whose effects can reach their peak during nighttime hours. Antihypertensive medications, for example, are often timed to provide sustained blood pressure control overnight. If their maximum effect coincides with a sudden change in posture, blood pressure can fall precipitously. Diuretic medications, frequently used for hypertension or edema, increase urine production, often extending into the night. This not only increases bathroom visits, but also contributes to potential dehydration and electrolyte imbalances. Sedatives or certain sleep aids, while promoting rest, might impair coordination, balance, and reaction time. The confluence of these medication dynamics with sudden nocturnal activity creates a hazardous internal environment. The convergence of hasty movements, potential dehydration, and active medication effects can trigger severe blood pressure instability. Orthostatic hypotension, the characteristic drop in blood pressure upon standing, can become dangerously amplified. Such a profound decrease in systemic blood pressure can critically reduce vital blood flow to the brain. In some instances, the body might attempt to overcompensate for this drop, leading to reactive hypertension. This reactive surge results in a rapid and equally dangerous spike in blood pressure levels. These volatile swings, from very low to very high pressure, place considerable strain on the entire vascular system. The brain's inherent ability to maintain consistent blood flow, known as cerebral autoregulation, can be overwhelmed. This failure of autoregulation leaves the brain vulnerable to damage from either insufficient or excessive pressure. A significant reduction in cerebral blood flow, even if transient, can precipitate an ischemic stroke. Ischemic strokes occur when brain tissue is deprived of essential oxygen and nutrients due to blocked arteries. The physiological conditions arising from a rushed, dehydrated nighttime bathroom visit are highly conducive to such ischemic events. Conversely, Abrupt and substantial increases in blood pressure elevate the risk of hemorrhagic strokes. Hemorrhagic strokes involve bleeding into or around the brain, typically from a ruptured blood vessel. The blood vessels of older individuals may be more fragile due to atherosclerosis or other age-related changes. These factors render them more susceptible to rupture under conditions of sudden hemodynamic stress. Consequently, these nocturnal bathroom trips transform into periods of heightened vulnerability for serious cerebrovascular accidents. Recognizing this direct and serious link is crucial for appreciating the gravity of the situation. Heightened awareness of these interconnected physiological risk factors is the cornerstone of effective prevention. Maintaining consistent and adequate hydration throughout the day is fundamentally important, regardless of perceived thirst. Openly discussing all medications, their dosages, timing, and potential side effects with a healthcare provider is vital. Adopting the practice of slow, deliberate movements when rising from bed can significantly mitigate orthostatic hypotension. A simple yet effective habit is pausing at the edge of the bed for a moment before standing fully. This pause allows the circulatory system time to adjust to the change in posture, stabilizing blood pressure. Ensuring clear, unobstructed pathways to the bathroom and utilizing adequate night lighting can reduce urgency and fall risk. Addressing the root causes of nocturia with a physician may also lessen the frequency of nighttime awakenings. Such medical consultations can explore treatments or lifestyle adjustments to manage underlying conditions effectively. These proactive and mindful measures can substantially diminish the risks associated with necessary nighttime bathroom visits. Prioritizing personal safety and physiological stability during these vulnerable moments is essential for sustained well-being. Vigilance and informed caution can empower older adults to navigate this common experience more safely.